I understand you have some information from Dr. Jha, who now is the COVID response coordinator there at the White House.
Yeah, that's exactly right. We just saw Dr. Jha here in the hallways behind the scenes in the upper press, the West Wing area that reporters are able to access. And he tells NBC News that President Biden started his Paxlovid course just now. In his words, the symptoms as he describes them, the president is tired. He has a runny nose and a dry cough. Dr. Jha says that President Biden went to bed last night feeling fine, but didn't sleep well, and then tested positive this morning. When asked about it, specifically the level of concern, a White House official tells NBC News, quote, very, very low. He feels fine at this time. So it's a little better color about the experience that the president is having personally as it relates to COVID-19. Obviously, those first few days after you test positive can be the most uncomfortable for anybody who's had this virus so far. So it's a good indication that right now his symptoms appear to be, as they describe them, particularly mild. As it relates to Jill Biden, the First Lady, again, you did hear from her just a moment ago, and I've been speaking to her press secretary by text for the last few minutes, and he tells me, as you saw, she was wearing a mask at her event in Detroit today, that Jill Biden, Dr. Jill Biden, the First Lady, is now, according to the CDC guidance, considered a close contact. She is following the guidance when it comes to masking and distancing, but that she will keep her schedule today in Michigan. She's in the Detroit area, and then later today, this afternoon, when she heads to Georgia. So Dr. Jill Biden, a close contact, but she is, at least according to her office right now, going to continue with her schedule as planned. As for the president's schedule going forward, Savannah, as we've been reporting, he will, as best possible, continue to participate. This morning, be meeting with some of his aides via Zoom and conducting phone calls with them as well. But obviously, he will be kept in isolation for an extended period of time, at least we believe what would be 5 days.
Real quick, Peter, you walked us through the protocols at the White House, the negative test that's required in order to be in close proximity to the president. Having had a negative test, then were people wearing masks, or I know masks were no longer required, campus-wide at the White House, but what if you were in close proximity to the president?
If you were in close proximity to the president, that's a good question. And I don't know if the rules said that you must wear a mask. Usually when we were around the president, we would wear masks. But frankly, sometimes when you're in close proximity after testing negative, you were no longer required to wear a mask. And I know that individuals had not. Out of an abundance of caution, particularly when we're gathered here in the NBC space, which is quite small, our team and many others do wear masks there, but I don't think there was a specific rule that said you had to wear a mask if you were around the president from any safe distance, having tested negative that day. But I think it is one thing that we'll be watching as how any of the protocols do change today. I'm guessing we will see several of the president's top aides and advisors, others who have met with him in the course of the last 24, 48, 72 hours, mask up out of an abundance of caution as they sort of continue their schedule over the course of the day. As I speak to you right now, we're exchanging text messages with others who are on campus right now to try to get a better sense of how this will impact their plans throughout this day. But obviously, this throws a wrench into any of the president's travel fresh off a foreign trip, and we'll continue to work on that.
All right, let me turn back to Dr. Patel. I wanted to ask you what the gestation period is. What's the best information we have now between a positive diagnosis and when COVID is contracted? I mean, it's hard to do the forensics here. Everyone understands it's all highly speculative, but the best knowledge we have now about COVID between when you get it versus when you turn up positive, how long is that time period generally?
Yeah, the average time period has shortened, Savannah. So it can be anywhere from, on average, 48 to 72 hours. So we're talking about exposure likely in the previous 2 to 3 days from when symptoms started. And I do think that they probably started yesterday, just that comment Dr. Jha made about feeling tired, et cetera. So then you go backwards. But we have seen exposures as long as 7 to 10 days. Those are outliers. So I would say this is more likely an exposure from much closer in time to yesterday when symptoms started. And because he's got such a rigorous testing protocol, obviously that was highly sensitive at catching it the first minute that he exhibited symptoms and was able to take that test and have a positive test. But it's a reminder. I hope the White House personnel, not just around him, but, this can spread very quickly, as we've seen with other kind of super spreader events where the president had attended in a previous administration. So this just is a note of caution that everyone should probably wear a mask, even if they test negative.
All right, and we've mentioned that the president is receiving Paxlovid. He took his first dose just now, according to Dr. Jha. Paxlovid it's a pill that you take. It's a therapy. It doesn't prevent COVID, but it's something that's supposed to shorten the duration and severity of the symptoms. How effective has it been?
Yeah, the studies show a reduction of hospitalization up to 88% in people who take Paxlovid, who are especially high risk. And those were largely unvaccinated people that those studies were done on. They included some vaccinated people later, and that number comes down. But it is thought, as you mentioned, Savannah, not just to shorten the duration, but it really blocks the replication of the virus. So it's important to take it as early as you can in your diagnosis. Most common side effect, I'm sure some of your colleagues have said this, it tastes like you're sucking on pennies. There's this metallic taste that is just so noxious. It's actually why some of my patients just stop taking the treatment. They can't handle that taste. But it's twice a day, 5 days. Other than that metallic taste and some stomach upset, it's relatively well tolerated. And these are drugs that we've used before in other viral illnesses. We have experience with them.
All right. And I want to turn to Peter Alexander. Peter, I understand a letter from the White House physician is expected soon.
Yep, that's exactly right. We do expect to hear from the president's physician in a matter of moments from now. I keep checking my phone as we speak. It's worth noting that his second booster shot was on March 30th. I want to make sure I get that right. It was on March 30th. But the new information that we're now just learning from the White House is that the press secretary, Karine Jean-Pierre, will brief reporters here at the White House at some point today. No time has been set. She will be joined by Dr. Ashish Jha, who's obviously become a very familiar face across the country for all of his expertise on this issue. The COVID coordinator here at the White House, or the press secretary, and the COVID coordinator expected to brief reporters and the American public at some point over the course of this day. As we have more details on that, we will share them with you as well.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.